everyone, welcome to Joanna Will Say. I'm going to talk about different acne treatment ingredients that can be available over the counter or it can be prescribed by your dermatologist, and also a few natural ingredients that are known to treat acne. But before we go to our topic, don't forget to subscribe to my channel, and also don't forget to click on the notification bell to get updates whenever I come out with a new video. The first one that I'm going to mention is benzoyl peroxide. Now, this is probably the most common acne treatment, and sometimes it can be a gel or cream, and it also comes in different concentrations from 2.5%, 5%, up to 10%. These ingredients targets inflammatory acne like papules, pustules, cysts, and also nodules. So this ingredient actually can kill the acne-causing bacteria. I have tried using this one before ever since I was in college. I would use it as a spot treatment. So I would just put it on the parts where I have the pimple, and then the next day I would really see that the pimple is dry. And so if you will use this product, it is best if you will use a moisturizer with it just to compensate the dryness. This one really works with your existing acne. It does really help kill the bacteria, and also it does really help with drying it out. However, this one doesn't really help out with the prevention of new breakouts, and so there is another ingredient for that I'm going to talk about, which is salicylic acid. Salicylic acid is extracted from willow bark, but nowadays it can already be produced synthetically in the lab. It is antibacterial, it is keratolytic, which means that it does really help soften all of those hardened dead skin cells on the surface of our skin, helping it to really push it off. It is also oil soluble, which means it can really go deeper into your pore, unclogging it and really clearing it out, which can also help prevention of future breakouts. Salicylic acid is an over-the-counter product, so you can just go to a pharmacy and you can just buy it without any prescription. And also, there are a lot of skincare products that do include salicylic acid. The next one is the vitamin A family, which is known as retinoids, tretinoin, retinol, and also isotretinoin. It increases cell turnover, and it also promotes the production of collagen. That's why you would notice that it is also used as an anti-aging ingredient. Also targets not just inflammatory acne, but it also helps with whiteheads and also blackheads. Retinoid and tretinoin are prescribed acne treatments, but now adapalene, which is a retinoid, is already available over the counter. So tretinoin is a prescribed oral prescription. It is known, or the brand it's known for is Accutane, but nowadays that brand is no longer available. So there are now other brands in the market. Isotretinoin comes with a lot of side effects, and so you have to discuss this one first with your doctor before jumping on to this treatment. With retinoid, tretinoin, and also retinol, it does also have side effects such as itching, peeling, stinging, and also burning, just what I have experienced because I have tried adapalene before, and it could really burn and it could really dry out your skin. So make sure that you use a moisturizer whenever you apply retinoids. There is also this cortisone injections. You can get this one from a clinic, and it can be done by a dermatologist. Usually this is done to your nodules, which are those very big painful pimples. It does help with reducing the swelling and also with the redness because it's anti-inflammatory. Again, this is only done in a clinic by your dermatologist, and also do not apply steroid topicals on your pimples because it's going to make it worse. Sulfur was used in the ancient times to treat skin conditions like rosacea, dermatitis, and dandruff, and it's also known as an acne treatment ingredient. It is antibacterial, and it also helps reduce the oiliness of your skin. And it is also keratolytic, which means it also helps with pushing off dead skin cells. Sulfur can cause your skin to be really dry and also a little bit of peeling. So make sure to use a moisturizer if you will go for this treatment. And also, this one doesn't really help much with severe acne. So if you have mild to moderate acne, then this is one of your options. This is also known as an acne treatment. It is anti-inflammatory, it is antibacterial, it's also antifungal, which is why it's also good for fungal acne or the Malassezia folliculitis. Tea tree also helps with eczema, nail fungus, and also dandruff. Sometimes this ingredient can be drying. In my case, it didn't really dry me out, but it just doesn't really do anything for me. I can use it, but it doesn't really help with my acne. The next one is apple cider vinegar. Now, there isn't really much research that proves its effectiveness in acne treatment, but I also know some people who have used this one and it did really help improve their skin. It contains citric acid and also lactic acid that have shown to help kill the P. acne bacteria, which is why probably it can be used for it. Apple cider vinegar is strongly acidic and needs to be diluted with clean water before applying it to your skin. I have tried this one before. I use it as a toner, but it didn't really help me with my acne. Now for the last one, it's azelaic acid. This is a natural occurring acid that can be found in grains such as rye, barley, and wheat. It is antibacterial, it is anti-inflammatory, and it is keratolytic, which can really help with removing those dead skin cells to help prevent future breakouts. So just in case that those ingredients I have mentioned before doesn't really work well for you, just know that azelaic acid can be your good option. If you have reached this part of the video, thank you so much for sticking with me. Don't forget to subscribe and click on the bell to get updates on my channel. If you like this video, hit the thumbs up button and share it with someone who might need this information. Thank you so much for watching. Eat healthy, stay happy, and take care.